Our next presentation is a result of the evaluations that people filled out. People said they wanted to know a lot about funding at NIH and how do we get funding, what's available. And so we have a senior staff member from ODS, Dr. Abby Ershow, who was a program officer at NHLBI for a number of years and literally is the world expert on everything NIH grants-wise. Anytime I have a question, I have a direct line to Abby, and I'm grateful for that. So please welcome her. I need a box to stand on like Queen Elizabeth when she was addressing the Congress. If I stand here, can you see me? This is the witching hour when that tryptophan slug crosses the blood-brain barrier. Feel free to stand up, move around, just as long as you don't fall asleep. We're from the government, and we're here to help you. Or you might call my talk Through the NIH with Gun and Camera. I hope you'll have questions. And if we don't get to them during this session, there's always email. Okay, now what? I'm going to give you an overview of the NIH and where it fits into the structure of the government. And then I'll talk a bit about where at the NIH funds flow towards nutrition research, and then give you some ideas about doing business with the NIH if that's something you want to do. Boxes. All right, so civics. There's the legislative branch of the government. That's the Congress, and what do? They make the laws, and they have the checking account, the Treasury, from which the money for funding the agencies comes, right? There's the judiciary, that's the Supreme Court and things attached to it. And then the executive branch with the departments, Health and Human Services, Agriculture, Defense, and so on, under the offices of the president ultimately. So we're part of the Department of Health and Human Services. And we have sister agencies like the Food and Drug Administration, the Indian Health Service, so on and so forth, okay? And you may be familiar with a number of these. So the NIH, you might think of, has a number of responsibilities. First of all, you've been here to the campus, lots of buildings, it looks like a university. The NIH conducts research in its own laboratories, which are primarily on this campus in Bethesda. And in our jargon, we call this the intramural program, within house, intramural, within walls, if you studied Latin. Also, we support research for people who don't work here out in the universities. We call that the extramural program. We train research investigators directly or through training funding programs. We foster communication of medical and health information to the public and to healthcare professionals. And we do a great deal to translate scientific information into guidance for professional societies and so on. So if you get your cholesterol checked and the doctor says, oh, you're above this amount or below this amount, and here's the treatment paradigm that we're going to follow, that stems largely from research and communications from the NIH. Of the budget, more than 80% goes out the door in grant and contract support. About 10% is spent for the intramural program and less than 10% overhead, much less, actually, which does things like put the light bulbs on and pay my salary. There are 27 institutes and centers that conduct research or support research, and there are 3 service units generally at the NIH: the clinical center, that's the hospital, we have an information technology center, and we have CSR, the Center for Scientific Review. Has anybody here ever submitted an NIH grant application? All right. So that is the Center for Scientific Review, which is the receipt unit, which then processes the application and has it flow through the system for review and communication with the institutes. So On campus, we have laboratories, we have the hospitals, and there are some field centers like the Rocky Mountain Spotted Fever Laboratory, which is in Colorado or somewhere out there, and so on. Extramural, 3 kinds of funding: grants, contracts, and what we call interagency agreements or cooperative agreements with other agencies and also with units, particularly doing clinical research. ODS, sorry, are you with me so far? ODS, that's us, down here, is a unit housed within the Office of the NIH Director. That's Francis Collins. All right, so now you know kind of where we're positioned. I'm going to focus largely on the extramural program because that's what pays salaries out in academia, you know. Generally, you can think of it as covering 5 types of research. It's basic science, right? Animal models. There is some basic research done in humans, sort of, physiology, you might say. In vitro work, in silico work, which is getting more extensive. There's clinical science, proof of concept studies, mechanistic biology. And for nutrition, this is where the efficacy or feeding studies would come in, controlled diet studies. Population science is cohort studies, behavioral interventions, effectiveness studies. Does it work out in the real world? There are demonstration and education programs. You know, can clinicians really make this happen in their patient population? And what a very popular term now, translational science, which crosses some of these categories. All right, alphabet soup. Do not write this down. All right, nutrition at the NIH, the heavy financial lifting, you might say, is through 4 institutes: diabetes, that's all those Ds, National Heart, Lung, and Blood Institute, cancer, and child health and human development, all right? And then there are smaller amounts that are put in by other institutes. You can look this up. I'm not going to run through them. ODS is actually in this second tier, all right? So we actually play a fair role. But almost everybody at the NIH, in one way or another, supports at least some nutrition-related research. And this is a graphical representation, and this big green thing is diabetes. Here's heart and lung, red for blood, cancer, and child health in blue. All right. There are a couple of coordinating offices. The Office of Nutrition Research, which used to be called the Division of Nutrition Research Coordination, has NIH-wide responsibility for tracking nutrition research and getting groups of people to talk to each other. The goal is collaboration, coordination, and minimizing, if possible, duplication of effort. And is working on a strategic plan right now and going through an exercise of that sort. There's also an NIH-wide obesity research consortium, and it's been very effective, has put out several strategic plans since it was started about 15 years ago, and has had a number of very successful initiatives working on practical approaches to obesity mitigation, research methodology, and so on. All right, and here we are, ODS. As you heard from Dr. Coates at the beginning, a major effort of the ODS is the collaboration in the funding of NIH research where it concerns nutrition topics. And so co-funding of, active grants, that means awarded grants, after the application makes it all the way through. And we also support, meaning pay for. The word support in NIH jargon means pay for. It doesn't mean you're being nice, you're being helpful. right? It means pay for. So there are what we call administrative supplements. Those are modest-sized add-on awards to larger primary awards that are paid for primarily by the regular institutes. Because ODS is an office. It's not an institute. It does not have the legal authority to do primary award of grants, which is convenient in some ways. And then we support also training and have a fellowship program. These are other major projects. I'm not going to go into them, but they are what we call research resources. It's important at the NIH and other institutes also support these to put money into things that make it easier and better to conduct research on various topics. So we put money and effort into these, and you'll hear more about them in these few days. All right. Next, here you are, and here's the NIH, and how do you make friends? All right, so again, you have to put your head into thinking about, here you are, and you've got whatever it is you want to work on, and the NIH may seem like a huge black box, but interacting with it, you have to think about the subunits and how they're put together. At each IC, institute or center, NIH jargon, IC, institute or center, those are grant awarding units, there are what we call program offices, all right? Those are the managerial units for overseeing the grant portfolios. And within these offices, the functions are review, which in jargon terms doesn't mean, oh, we'll take a look at it. It means the formal process of evaluation and scoring. It's highly regulated, AKA involving the study sections. Who here has heard of study sections? Okay. They are committees chartered by the review units at the NIH. In effect, short-term employees of the NIH to perform the review function. And then there's grants and contracts management. These are the business people. They have the authority to transfer money amongst checking accounts. Our checking account to ideally your checking account, i.e. the university's checking account, not that it is yours personally, right? And then we have policy and budget people. So what do? The point is to address the scientific mission of the institute or the center as chartered by the Congress and congressional-like wording that allows us to use the funds. What are we here for? Prevent and cure heart disease or whatever. The extramural offices also provide service to applicants and awardees. We refer to it for applicants as guidance, right? Help you, scientific social work. We help you navigate the system, right? That is the goal. As citizens, you deserve fair process, fair hearing, if you are applying for funds from the government. Doesn't mean you will end up with the outcome you're hoping for, but the goal is to have a fair process. And then if an award is made, God willing, they are administered with lots of rules and regs, with various funding mechanisms. We'll talk about that. We talked about peer review, and then after award, oversight, and to make sure all goes well and everything is in compliance. So the Center for Scientific Review, most of the grant applications come in that way, not just for the NIH, but other agencies as well. Like the CDC, for example, if the small number of grant applications that they have are processed through the NIH Center for Scientific Review. Why am I looking up here? I should look at my screen here. They review the regular plain vanilla funding opportunity announcements, the regular system that takes in applications several times a year, what we call the parent funding opportunity announcements for things like the R01 mechanism, that's the regular grant, and training mechanisms and so on. Also, small business grants, technology transfer grants, there's R43, 44, and 41, 42 mechanisms. Everything's got numbers and codes. And the study sections that review nutrition-related applications, there used to be something called Nutrition Study Section. That got reconfigured and renamed. It's now called Integrative Nutrition and Metabolic Processes, INMP. They all have long names. CATO, Clinical and Applied Diabetes and Obesity. CETO, Integrative Diabetes and Obesity. You know, so they all have these 3, sometimes 4 letter names, abbreviations. And there's a list of these on the CSR website, which the link is up here. Sometimes the institutes and centers issue RFAs, requests for applications, or for contract proposals. Then we call them RFPs, requests for proposals. And those are reviewed in-house, not by CSR usually, but rather by review units that are housed within the institutes and centers. That's because there's a lot of special considerations that go into the reviews. All right, I want to go back to the term mechanism. We refer to a funding mechanism. It has to do with the type of award and the terms and conditions. What are the qualifications of the applicant? What career stage must they be in? What are the budget caps? What are the time frames? Is it a clinical trial? Does it involve animals, and so on? And so there's a long list of these types of mechanisms, and it can be a little confusing. And one of the things, and we'll talk about it later, of why would you call the NIH before you wrote your grant proposal because you have this fabulous idea, because you need to know what is the most suitable mechanism to apply for. It will help you structure your application. It will tell you how much money you can ask for. It will help you frame the entire structure of the project, which may lead you to redo the design. So there are contracts and interagency agreements. Those are between departments of the government. There are individual investigator awards. There are large group grants. There are things related to, you want to build a fancy MRI machine and work out some of the glitches. There are some that support that. There are training mechanisms, and there's small business and technology transfer awards. All different, all put together differently. What is a funding opportunity announcement, a FOA? A FOA, that's what we call it. It's a solicitation. You might think of it as if a publishing house, puts out books, and it's got a cookbook division, and authors write up their cookbooks and they mail them in, but the editors, after a few years, realize they have nothing in Italian cooking. They may put out an advertisement that says, we want proposals for Italian cookbooks. That would be a solicitation, all right? And it's used by the institutes to help develop the portfolio and to get applications coming in on special topics that are otherwise underrepresented in the portfolio. And they often have special review considerations and set-aside funds. Sometimes they don't want set-aside funds, but want to kind of advertise to the community. A program announcement is what is called. It's called a PA. All right, so if you see a PA, it's an indication of interest in the topic. Sometimes a little higher funding priority, but no set-aside funds. RFP is for proposals. It goes through contracts, very different structure, all right? And then there's the parent FOAs, or omnibus for small business. You may see that announced. All right. So a word on small business, which comes up a bit in dietary supplements world. We do see applications coming in periodically about development of a particular dietary supplement for a particular use. And it's a small business making this stuff, and they want some money to help develop the product and test it. And occasionally, these make it through review. They have to be checked. The idea is that it is research that will lead to a commercializable project. And it may be a small business entity, or it may be a university-sponsored research institute product, right? And that, this is a very favored sort of mechanism. It's thought to be good business incubator kind of award that leads to jobs, that leads to development in otherwise remote areas of the country and so on. Anybody here kind of junior? Are graduate students here, postdocs, junior faculty? All right, so the NIH is very concerned about the development of research workforce and has a number of training mechanisms. There are individual awards for people in graduate programs, fellowships and career development awards. And then there are what we F&K mechanisms and what we call T awards. Those are institutional research training grants. I went through grad school on a departmental training grant that was funded by a T award from the Heart, Lung, and Blood Institute, and here I am. Sometimes there's also an interest in increasing the diversity of the biomedical research workforce, and supplements can be awarded to existing grants for the support and training of individuals from underrepresented minorities and so on. All right, so the program office. What does the program office do? So we talked about portfolio management, right? The oversight of awards. Also, funding decisions, right? That is within the institutes with recommendations from the program branches within the institutes as to which applications should be considered for funding of those that have adequate scientific merit. There is not enough money to go around. The pay line is pretty pathetic right now. It is super competitive. So it's tough, and there's a lot of justification and evaluation that goes on before a decision to award is made. The program offices do portfolio development. They issue solicitations, right, to build up the portfolio in underrepresented topics, and often hold workshops and conferences in advance to help refine the ideas. And we talked about training mechanisms. The idea is to build capacity for research in locations that may need extra support. So that's the program office. Now, what about the program officers or the program officials or the program directors, or the medical officers, called many things? So what do we do when we're doing this? We manage the portfolio. We provide guidance for applicants about the submission and review process. Observe the review meetings, in part of the system of ensuring fairness and equity. For people who receive awards, we provide guidance on their responsibilities. Things come up, handle the oversight, with approvals and budgets, and we monitor progress, and we read those progress reports. You would not believe what people write in those progress reports sometimes, because they think we don't read them, and they become a vehicle for expression of all kinds of completely inappropriate sentiments with regard to colleagues or the institution. Don't do it. We read them. I'm telling you, you would not believe. This is the dishes and laundry and housekeeping of the extramural officer's job. We read those reports, and then we write reports on the reports. Right. And we develop the portfolio. That is partly the candy, because it lets us keep current with the science. We look for where do we need to support more research. We develop solicitations. We run workshops and conferences and so on. It's a great job. And the next question is, what can a program officer do for you, right? This is your human person within the government who can advise you on interacting with the government, right? Not the IRS. There is no penalty for picking up the phone and calling. And the kind of guidance that you will get can prevent so many mistakes, so many errors, so many unfixable problems that are preventable but not fixable, right? Sometimes at the universities, sometimes people have had a less than rewarding experience. And they may say, oh, no, no, don't call them, don't bother them. That is not good advice. It truly is not. You may need to talk to somebody else from whoever they interacted with. But really and truly, you are far better off for calling. A good way to do it, you call, you email a little blurb, right? A draft title, a draft abstract, a draft list of what you want to accomplish, and then you set up a call to talk about it, all right? And that is the kind of information that will help the program officer to give you guidance about where should it be reviewed, what study sections are suitable, which funding mechanism is a good match for you as an investigator and for the project as a project. We'll talk about which of the institutes and centers would be the most programmatically interested. Where is it responsive, whether to general solicitation or a specific one, right? Your goal is not to make a misstep in submission, all right? After submission, all right, you could hardly come up with a more competitive system, maybe Olympic trials, I don't know, all right? The most likely outcome, the most highly likely outcome is a score that is not fundable on the first pass. That's the most likely outcome. So the program officer can give TN sympathy, right? And we mean it. It is a tough, tough game. You must steel your ego. We can review the summary statement with you and offer some insight as to what the study section would like to see in revision generally. Can't redesign it for you. We're not going to tell you which buffer to use, but generally, or whether it does not make sense to revise and resubmit, right? And then procedurally, sometimes there's appeals and things like that, but not usually. That is rare. That is not generally what happens. How do you find these miraculous people? Right, so nutrition as a topic is spread throughout the NIH. But there are not very many nutrition branches. So if you go hunting for a nutrition branch, you usually will not find one. One way is to look at the NIH reporter, right? And it has a listing of current and past funded projects, and you can put in the keywords, and you can see which institutes have funded on that topic. And you can look up how to contact that institute and call, and eventually you'll end up with a suitable individual. You also can look at the Office of Nutrition Research website, and usually there is an indication who the institute representatives are from the Heart Institute or the Cancer Institute. That person is also going to be able to then send you to whoever you should talk with. And then finally, I think this is my last slide. If you want to read more in depth about grantsmanship technique, shall we call it, right? There's an art form to writing up your ideas in a way that communicates well with the study sections. NIH, that's our friends, allergy and infectious disease, the people that bring you AIDS research, those guys, have the best grantsmanship website at the NIH. They have all kinds of things about the grants process, including how to get over the pain of a review that criticizes your work. They have a great website about the small business application methodology. And they have, are you waiting for it? Sample applications and summary statements. These are basic science, doesn't matter. It is really worth taking a look at these. They're from a couple years ago, doesn't matter. They got permission from a couple of investigators who had done well, but who were willing as a teaching tool to let their applications and their summary statements be posted for the world. And it will give you a feel for the degree of depth and carefulness and detail and inspiration that's needed to write a successful application. So we have a few minutes. I can take questions, and thank you for your interest. So. Yeah.
Can you just describe sort of your ideal portfolio and what you would go home super happy about one night if you could just perfect this portfolio?
My ideal portfolio?
Just, or the general, idea. I'm just trying to get a feel. I hear people talking about, the portfolio.
Oh, okay. So the ideal portfolio is one that addresses every major scientific gap with high quality research, from mass to public health, you might say. So the institutes, each institute has its own portfolio, right? The Cancer Institute has a portfolio of grant awards, some of which address basic carcinogenesis, some of which go into tobacco and what it does, some of which go into public health strategies at a certain level, or individual behavior change in getting people to stop smoking, for example. And an ideal portfolio has a mix of all of these things, and it covers all the areas of responsibility of the Institute. Does that? Yeah. My ideal portfolio would include more projects on iodine research, because that's what I work on. But, yeah. Other questions? No? Yes. And, okay, well, I'm around. You have my contact information. Oh, wait. Oh, good. Yeah, sorry.
Can you say more about the epidemiological research in nutrition and dietary supplement research? The population research?
Well, say more about it. You mean who funds it?
Who funds it? What general topics are of interest?
Okay, well, let's see.
For example, secondary analysis of large data sets, or
yes.
original
All
research.
Right. Well, the easiest is for me to talk about the Heart, Lung, and Blood Institute. NHLBI, as we fondly call it, has supported over the years a number of major epidemiology studies like Framingham, Jackson Heart, Women's Health Initiative, and so on. They collected dietary data. Many of these data sets are now public. And there are, in fact, solicitations, whether from the Heart Institute or sometimes others, and when they appear and then they expire, you have to keep current with these things, on secondary analysis of existing data set. These are small awards. Sometimes the RO3 mechanism, sometimes the R21 mechanism is used. So the NIH guide for grants and contracts is where these are posted. So other institutes also have sort of parallel programs. So does that answer your question?
It does partly, but what about things like original survey research?
So, I mean, one can apply, for awards for projects of that sort, depending on the scale and what you're trying to do. Sometimes they are part of large contract-funded projects, multi-center projects, but also they can be supported through regular grant mechanisms.
Including things like pilots?
Pilot studies, depending on how they're structured, the R21 mechanism sometimes is suitable. Thanks. That's why you need to develop your basic idea and then contact, depending on what you're studying, and then be in communication with the program officer at an institute whose purview covers the topics that you're focusing on.
If no one else has a question, I have another question.
I will eventually, but you can go first.
Well, why don't, we have a few minutes here, yeah? Well, okay.
So, me?
Sure, why don't
Okay.
you go, and then Howard.
So I was previously at a very large research university which had an amazing research infrastructure and gets a lot of NIH funding. And I am now at a very small institution where we're developing a research program. And you know, when you write your NIH grant, you have that whole section about the support and all.
Yes.
And I know that that's a big factor in getting a research grant from NIH. But what happens when you're at a small institution where you don't actually have that infrastructure and you're doing a relatively modest project and you don't have a bunch of people on, you know, in your faculty or at your institution who have done a lot of NIH, who have gotten NIH funding?
Right. So there are actually funding mechanisms. One is the R15 grant mechanism that are specifically structured for low resource institutions and states that area grants are called, that have very, like, I don't know, pick something, Wyoming has very little NIH funding. It's not eligible, but not a lot. And so certain locations and certain types of institutions are eligible for these development awards. So, you know, if you like, you know, send me an email and maybe I can help direct you to somebody to contact. Yeah, Howard?
Yeah, no, that was a nice synopsis of everything in terms of grantsmanship. I guess one question, since we're all here to be learning about dietary supplements specifically, it was nice that you're framing it in the context of nutrition research, but what about if you're interested in dietary supplement research? Are there specific resources, specific people that you would point people toward to think about either grants that are planned or otherwise?
I would say just contact the Office of Dietary Supplements, and Cindy Davis particularly sitting back there. There's certain things that ODS can do and certain things it can't do on its own. And so we punt, you know, when things are what somebody else should be handling. So just call. Yeah.
So I'll just add to that. As Abby already said, we cannot directly fund grants, but at least most of the NIH institutes and centers don't necessarily look at dietary supplements as anything different than the spectrum of nutrition. So anyone that you would contact at different institutes, if you're looking at a specific disease condition, that you would contact for nutrition, you would contact also for dietary supplements. With that said, if you're interested in administrative supplements or want to find out about co-funding or anything like that, I'm the person to contact. My information's on the NIH website, and feel free to send me an email at any time.
Yeah.
One of your initial slides was the whole organization of NIH, and I'm not sure, what's the NCCIH, the National Center of...
It used to be called NCAM,
NCAM.
Alternative Medicine, now Integrative Health.
So doesn't that overlap a lot?
Yes, we're good friends with them, and we have a way of interacting. We interact with them a lot for this sort of thing, so.
Well, if I was interested in finding out the most current research on a certain lutein or something like that, which site would I go to?
You would go to the NIH reporter. I mean, if you want to find out who's being funded right now to do work on it, you would go to the NIH reporter, you put in the word lutein, and you will see what pops up. And it may be in more places than you might guess. So, yeah. Like the Eye Institute, for example. Yeah. Yes?
for those of us that are working with a smaller track record, maybe doing mid-career, start on research, et cetera, obviously having the track record helps the reviewer, but does riding along maybe with a stronger PI first time help, or just?
It depends. This is where you would want to get some guidance from a program officer in the field as to what's the right mechanism. Working with depending on how far out you are from your terminal degree, there's a certain time frame when you're still considered an early stage investigator or a new investigator, and there are certain times when it is useful to partner with a more senior person, and sometimes when it's not. And there are different types of partnerships. There's co-investigator, and there is multi-PI. Multi-PI sounds good, but is not always suitable. So that's the kind of thing you really need good advice on. So,
Great, thank you.
sure. Yes.
I had a question about co-funding, and
Sure.
this is sort of mysterious to me. When you're developing a project and you realize, yeah, that fits really squarely in their wheelhouse, but also in their wheelhouse.
Oh, okay.
Does
Only one person can take that puppy home from the pet store. All right? When you, if you submit and it says primary institute, pick something, heart and lungs, secondary institute, diabetes, okay? And that's what it does not mean that they will say, okay, we'll each pay half. Here's why. Because the Congress requires each NIH institute to issue a certain number of grants per year. And a grant can only be counted once in that way. So the regular institutes almost never, except for things like major clinical trials, they almost never split the funding. So it means more, it could be assigned to one place or the other, and there's some negotiation occasionally as to where's the better fit. Does that answer your question? Yes. Yeah.
Hi. So when you say call as early as, do you mean when we have the idea or when we have already drafted something that?
Well, if today you have drafted the thing already, then call. If you know, I would say when you have the idea well enough to write a short draft abstract, to give a draft title to the thing, and specific, it's not binding, all right? Nothing holds you to it, but it's a basis for discussion. That's, you should have enough of that to be able to have a conversation, to get, you know, otherwise they won't know what to tell you except to go do it, so. All right?
Okay, we are on break.
There was one final one up there?
Just, yeah, if nobody else has any questions, I was curious when you mentioned that you've seen some successful obesity interventions. Could you give an example of some of the successful obesity interventions you've seen?
Successful interventions? Mm-hmm. Well, I don't know about successful exactly, but I can tell you about one program that came out of some of the work that was supported by the Obesity Research Task Force programs. There was a multi-award program called ORBIT, ORBIT was the acronym, Obesity Research something intervention trials, that was sponsored with funding from cancer, heart, lung, diabetes, and child health. And these were projects where there was always a basic behavioral scientist as a PI, and also an applied behavioral scientist, where they would do a basic mechanistic behavioral science project and then develop an intervention based on it. And there's a website for it and many publications. That was an extremely interesting program, and it developed a number of interventions that proved actually quite useful in clinical application. Okay, so we can get back to this later in the day and over the next few days. Thank you.
Okay, everyone, we are on break now.